Thank you, everybody. We'll restart things by running through some of the experiences that Milton Keynes University Hospital Trust have had in looking at BIM and their digital journey and looking at how they can do things smarter to improve patient and staff experience. Unfortunately, Claire Orchard was meant to be here, the head of digital at Milton Keynes, but she can't be here today. So Steve and I will try and cobble through the story and give you a bit of information as to what they're looking to do and what they're looking to achieve. So setting the scene slightly, for those of you, some of you may be familiar with Milton Keynes, many won't. It's a mid-sized district hospital, 550 beds, 4,000 staff serving 400,000 patients per annum. They've recently been going through a sort of quite rapid reform on site in terms of adding a cancer centre, so moving their services from in and around the hospital to having a dedicated cancer centre, and are looking at some additional development moving forwards, which they've secured government funding for. In terms of the cancer centre, that was a £15 million project which completed in 2019. This was a project that had to be delivered, as everyone said, I think, delivered in BIM. So the proposal was submitted to government, funding was granted on the basis that it would be delivered in BIM. It was really looking, as I said, consolidating the services from across the hospital into a single ward, 24-bed inpatient ward, 16 single rooms, and then 2-bedded bays in the rest of it. So quite a significant investment. However, there were a lot of pain points in putting this together from the point of view of the trust. As I said, BIM was implemented and BIM was used as a word in many ways, but I don't think the true process around BIM was followed. I'm a hater of BIM. I'm going to put it out there. I'm a hater of BIM. It's a concept that limits what people are trying to achieve. What I would rather talk about is the data capture process through architecture, through construction, and then into the ongoing management of the project. And I think that people hide behind the word. I think Harry mentioned it. People try and buy BIMs. I think what we need to talk about is the concept and what we're trying to achieve. So if you look at what happened here, there was a lack of cohesion between the AEC, the architects, the engineers, and the contractors on this job. Data wasn't entered correctly. There was no checking process at the end of the project. So although it was meant to be a BIM delivery, if no one checks it at the end and makes sure it's BIM compliant, what's the point? If that data can't be used moving forwards. The delays in obtaining the information, some 2 to 3 weeks of manual data collection before entering the building. From my experience, that's commonplace. The CAFM, the FM departments haven't been engaged in the BIM process, and they aren't able to take the data that's been produced during the design and construction phase. So what they do, they get a Revit model with a load of data on it, on a USB file. They take that USB file, put it in the third drawer down, and never look at it again. What should be happening is obviously very different to this. Level of detail wasn't right. So again, they'd taken an off-the-shelf BIM specification that they'd found on the internet, or I don't know where they found this one, but it didn't give them the level of detail they needed to actually operate moving forwards. One of the examples Claire talked about was a window. So they had all the information about the window, they had the information about the glass, but they didn't have the level of tint associated with that glass. So they couldn't order the product. They didn't know what it was. They had to send somebody up to look at it. And I don't know how you tell what tint level a window is when you've got it installed. So very labour-intensive, cumbersome way of going about work. This is a quote taken from a case study we did with Milton Keynes. The creation of data needed to manage and maintain our buildings was not something we fully owned or could access quickly and easily. So in addition to not having this data, the common data environment was owned by contractors or by architects, so they couldn't even access that data retrospectively moving forwards. I don't know if you want to step in here, Steve, and talk about the proof of concept, but in effect, what Claire and the team did was look retrospectively at the cancer centre and apply BIM to it properly, apply a strategy to it that would have given them the right data coming out the other side, and doing some of the manual stuff to get to the level of data that they wanted. Do you want to jump in?
Yeah, so basically what we had was a Revit file. That's what got delivered. That's what everyone classed as BIM on the project. There was no data structure, there was no information embedded, hence why they had 2 or 3 weeks of populating the data afterwards. But even then, there was information missing out of that model. Now, we did our best to fulfill this. We worked with Claire and the team to try and get that bi-directional flow of data. But we soon found, as Richard just said, yes, we knew it as a window, yes, we knew it's a certain size, we didn't know anything else about it. And it was quite clear that the word BIM was abused. You know, people say, yeah, we need BIM. There was no full, true requirements, literally stated. And, you know, the way we've gone with this now is we worked with the trust itself to generate this EIR and AIR. So that's an exchange information requirements and an asset information requirements. They were 2 key documents that we worked with the trust on. But it's not just, as we were saying before, it's not just the management department that we talked to there, or the estates department. We chatted to the IT teams, the maintenance teams, as we're doing with other trusts, you know, because that's where we're going to get the information needs from to define those 2 documents. Now what's happening is basically we've got another job which is called the imaging centre on the site, and we've submitted that EIR, AIR to the contractor. They've signed up to it, and we've now got full structured data being delivered. So from having the word of BIM or digital delivery isn't the way to go. You need to define exactly what's needed. Then you're going to get that structured data. Now, you don't have to have COBE. That's just to warn everyone that ISO 19650 states data, COBE and all this structured data. It all depends where it's going. If your CAFM system won't read COBE, don't ask for COBE. If your FM system is having structured data in an Excel form, that's what needs to be delivered out the model. Yeah, not COBE, because it doesn't work for you. And that's why everyone's digital strategy is different. Always start with the end goal in mind, and that's what we did with Milton Keynes. Look at the end goal and work backwards. Look at what technology they've got in place, look at the maintenance systems they had in place, work backwards. That's how you're going to get these documents done correctly and get then the contractor and that project team to actually deliver in the way that it needs to be delivered. Okay? All that is nothing to do with technology. Yeah? That is just workflow, processes and data, not platforms from Autodesk, Oculo, Unity or whatever. It's process data requirements. The technology will help you capture it, will help you deliver it, and make you more efficient at delivering it. Okay? So now, you know, we've got full bi-directional flow of assets. That's where we're looking at now, of this proof of concept with them now. And this new imaging centre that we're working with has completely changed that, you know. And some of the next steps that we're looking at that now is, you know, looking at the full digital strategy with them. Basically, they've now got, I think it's a 5-year plan of where they want to get to. We've now got a system in place where we are structuring data. We've got to look where we go from there, you know, because they want to be able to, if there's a heart monitoring system, where is it? So they want to be able to know, oh, it's in this ward, so if a doctor needs it, they can just go on a phone and just say, where's the nearest heart monitoring system? Bang. Oh, it's in ward 23. Can someone get it for me? They know where it is rather than trying to search for a ward. That's where they're trying to get to. They want to be able to know movement around the hospital. So this is this word, you'll hear it probably a few times a day, digital twin. okay? This is the next phase from having that structured data. Your digital twin is basically looking at live data from the hospital, looking at the temperatures, the movement of people, the CO2 emissions from all your devices that are generating the heat and power within the building. Sensors can link to the model, and you can display that in technology, so you can really see where deficiencies are within that, where the improvements could be made, and all that good stuff. And we look at the way to improve this data capture. There was another job at Milton Keynes, which was in mid-construction, and again, it was done in BIM. I keep doing that, I don't know why, but it was asked to be done in BIM, and basically we were going to get another Revit model again at the end. So we approached the contractor and said, can you deliver us code BIM? We actually issued them that EIR and AIR mid-project. The response was, yes, we can do it, and they offered us a 6-figure sum to get it to where it needed to be. So it's just a warning to everyone, be careful with this digital strategy, because if it's implemented at the wrong time, it can cost you money. If that digital strategy, that EIR, AIR, etc., was implemented at the beginning of the job, there wouldn't have been any extra costs. We'd have got great data, great delivery, but because we approached the contractor mid-term, halfway through construction, there was an extra 6 figures that was going to be added. So again, we're just going to end up with a Revit model at the end of that one. So just be careful about the steps that you're taking, what's happening with the data, etc. One of the key bits was the ownership of the project data. I was talking to some people in the break and data is key, because what you've got to look at is the tools around now that can help you to be more proficient in capturing the data. And when I mean by data, drawings, documents, O&M manuals, data sheets, that can be passed to you in a more structured way. If you look at, if you can go talk to the Autodesk people at the back there, the Autodesk Construction Cloud, unlimited storage, you can push laser scan data in there. It's automatically backed up for you. Yeah, you've not got the extra fees of additional storage, cost, servers, problems, networking. It's in the cloud. This is the future of that, and this is what we've done with this trust, is the fact we've pushed all their data now into the cloud. And what that means is when anybody's delivering data through construction, through design, they issue it to the trust. The trust then have, they don't need the likes of AutoCAD viewers and PDF viewers and things to measure the things on drawings, all that good stuff goes. Because one platform where it's stored will do that all for you. So actually they're making savings by investing in the digital strategy. Because the construction cloud is a way that we can push it up there. You've got the data live handed to you rather than, as Richard said, on a USB stick that gets shoved in a drawer and never looked at. It's there, people can view it, engage with it, and you can use it going forward. Because the biggest thing with all this digital strategy, what happens when it's handed over? Because the day it's handed over, it's out of date. Yeah? How do you keep that up to date? Your estate departments take down walls, add walls, the ward changes around, the model's out of date from day one. How do you keep it up to date? If you've got tools that you can have on phones and tablets, and as things change, simply mark them up. They can be all captured as markups and changes, and at periodic times, you can update the model, or the drawings, or whatever, but at least you've got a record of the changes, and that's easily done on phones. Dropping pins onto a plan and saying something's wrong here, capturing photographs and things like that, all can be linked up. And you saw Tom's presentation on Oculo. To be actually capture the asset in its live position, and you know exactly where it is. So if a sensor breaks, you're not going to go and search for it, you just search for that asset. It takes you to that environment. You know where it is, you know what it is, you know what's installed around it. And that's really key, And as I say, this digital twin thing is now the next stage. Yeah, it's moving it on from just data. So where they're going now is they're looking to use barcoding to allow them to gain assets. I don't know whether anybody's seen barcoding in operation. It's huge. But don't think of a barcode just on an asset. A barcode could be on a room. So when you scan as you walk into a room, it will tell you what assets are in that room and things like that. So there's lots of things we can do reusing that technology. Yeah? But it has to be captured correctly. We can look at, you know, the way that we're linking all this information together, because what you want is your maintenance teams to be able to get out there and say, ooh, this light fitting's broke. Oh, right, it's from that manufacturer. Oh, there's the data sheet. I can go and order that straight away. Rather than thinking, right, I don't even know what light it is, as we've just said. Go and try and find the manufacturer, reorder it. You've ordered the wrong one. It's time. If you've got it there, link it, reuse it. You know, and then it's looking at that specification. They've got performance monitoring now because of sensors, and that's where we're starting to link this. And these things are called Internet of Things, so that's what IoT stands for there. So it's things, you've probably got them at home, you know, with Alexa and Google, whatever it's called. What's it called? No, the Google one, anyway, the one that you talk to from Google. But you're starting to see these coming into your own house now, you know. Alexa, switch the lights on, bang, your lights come on, and things like that. That's now coming more and more into industry, and we're using that. And it's all about improvement. So your digital strategy and what Milton Keynes were looking at is not just, yes, we want a model, yes, we want data. It's how to reuse that data, how to reuse that modelling information to their benefit. Yeah, you know, and that's the part of their strategy now for the next 5, sort of 6, 7 years, really looking forward. So yeah, it's a great journey they've been on. We've certainly enjoyed working with them on that, but it's just great to see that they've not just asked for a model and data, they're now looking at that next stage of what do we do with this, how do we get benefits for the hospital and the trust moving forward. And you know, like I say, this new building, this imaging centre that's going up now, it will be the first one where we've got the full workflow running right the way through to their maintenance system to give them the full benefits, really.
I just probably add to that a bit, and around the ongoing digital strategy, it's really about what they're trying to achieve as a trust. So, you know, one of the big goals of the trust is to reduce carbon emissions. So what they're using is this underlying data, a bit of smart technology, and they're able to track, you know, temperature across the hospital. They're able to track output from radiators across the hospital and control them remotely. So there are huge savings to be made from that, what feels like quite a simple way of going about business, if you've got that underlying data and you've got the right level of technology. Similar for parking. I don't know who's tried to park at an NHS Trust, but it's like war out there. I tell you get people, yeah, it's an impossible task, and then you get a massive fight when you try and get into a car parking space. So what they're looking to do is, you've probably seen it at some of the airports, and it's not rocket science, but it's sort of highlighting where the available spaces are and moving people to those available spaces as quickly as possible. Not going to solve the problem of a shortage of spaces, but it's going to minimise that disruption. It's going to minimise that poor experience for patients, because that's the first thing they see when they come to hospital. Well, my first engagement with it when I come and try and sell stuff is always a bad one. If I'm trying to park the car. So we've probably got about 4 minutes. So if anyone wants to ask questions, then me and Steve will do our best to answer them. But I think this is coming back to the point made earlier about what does the future look like, what can be achieved. Tom's shown some tech. We've shown some words about what can be achieved, and then I think Jackson has shown some more tech. And hopefully that's building that picture of what can be achieved and what good could look like. But it's about those goals. What are you trying to do? I'm trying to reduce energy usage because I want to reduce carbon, I want to reduce costs. I'm trying to reduce the situation that is parking. So yeah, any questions, happy to try and field them.
Sorry, I've got another one.
No, that's fine.
You were saying that you upload to the cloud. Yeah, you upload to the cloud.
Yeah.
What have you done over the risk assessment of sabotage by the enemy, and the potential damage during the solar peak that's predicted in, I think, 24 or 25, which may well cause damage to the storage systems, even if they're not hacked into. And we know that they are already hugely under threat. So have you got another, what you might call almost a harder backup system as well for your product? Are you actually providing some alternative hard storage?
So the system that we use is obviously the Autodesk product. It's basically built on Amazon Web Servers. If that's hacked and goes down, all our traffic lights, everything, banking systems, the whole lot goes.
Yeah.
You know, so it's not just a software platform, but it's an industry world problem really. I mean, what it'll be is the software itself has got dual factor authentication, so it's restricted as much as it can be. You know, it meets all the security protocols and all that good stuff. Single sign-on, if that means anything to anybody. It's a platform that is protected as much as your banking. Yeah, so if you lose your banking account, I'm afraid you'll lose what's stored in the cloud, but it's as good as the world's got at the moment.
Yeah, I mean, the alternative is to allow on-site downloads and storage of the data, but the volumes of data are so cost prohibitive that there'd be issues there, if I'm honest.
So how many terabytes of data do you reckon it is that you will have had from a project like this?
Completely dependent on size of hospital, number of sensors, it could be anything. Like, honestly, the numbers
I mean, the platforms are unlimited storage within them. You know, so even if you're laser scanning, one laser scan could be a terabyte of information.
Yeah.
But because the platform's limitless, you can just keep storing it and keeping it collated together in one place.
And then my other question was going to be, how have you evaluated the efficacy of you coming in and sorting out their problems? Have you been able to put a number? You said how much it cost because of the errors that have been made. Are you able to project how much potential saving over 5 or 10 years from the errors that you picked up? And also, how is it being evaluated by the people who using it as the new cancer centre now? And one particular point, I was intrigued, you spoke about 2-bedded wards. And our own experience in the hospice was that 2-bedded wards didn't work because people didn't like sharing a room with a complete stranger. And so in the end, the 2-bedded rooms became family rooms, so it would be one patient and their family member could stay with them, which worked very well, but it meant effectively we lost a bed in each of those 2-bedded bays. And bizarrely, we found 4-bedded bays worked better because there was a degree of sharing and anonymity.
So if we tackle the question about savings and the cost, I mean, to be fair, during the delivery, the cost will be the same. So if it was done traditionally in CAD, 2D data, or let's say Revit, 3D data with structured data behind it, there's no cost on delivery. We're finding now, well, let's say 7-8 years ago, the cost was silly. As soon as we asked for BIM, everyone just put a note on the end of the quote and put it in because they used it as a training exercise. So it's, yeah, we'll do BIM, add a note on, let's use this opportunity to train everyone up. That's going now, because even if you go to an architect and say, we want this building designed, they'd probably do it in a BIM process they've got established because they're seeing efficiencies in-house now. So that's going. So I would say now that we're on a par with whatever you decide to deliver it, it's the same cost. The savings are after PC of the project. It's collating that data. The maintenance teams have got it at their hands. That's where the savings are coming. As we said, I think it was a few slides back, it was 2 or 3 days of a team inputting that data. That's gone now. There's no surveying needs to go. There's no inputting of data. That's not required.
I mean, the one thing I can speak to is the resurvey after, somebody's thrown an MP3 file away. On a big hospital, it's hundreds of thousands of pounds, and it's weeks of work. On that cancer centre, it's 2 to 3 weeks of work. £15 million bill isn't vast, but 2-3 weeks of work is going to be tens of thousands of pounds. Just have somebody walk around and write down what you've got in all the various places, and then surface that information.
Steve, you mentioned as data and client-specific FM, and I think we started from by seeing clients requiring Kobe, then clients requiring both, so both Kobe and their specific FM. So I wanted to ask you, what would you advise them to do? Would you advise them to just use one option or go with both to have some kind of backup?
So if anybody, yeah,
Do you want to cut this one?
if anybody's looking at this, you get the BIM crew, I call them. They will come in and say, you need Kobe, you need a structured IFC with Kobe data in it, you need this, that and the other, and you'll probably use one of the 4 that they ask for. It's looking at what you need. So what we do is look at that FM system, approach and work with them. How do you input into that system? If it's, and again, it comes to that maintenance team. They're out there. What happens if something breaks? Oh, get I'd call it a PDA or your phone these days. Get the phone out. There's probably 8 bits of data they're interested in, not the 54 bits of data that Kobe gives them. So why are we collating them other 48 bits of data? You're never going to use it as a trust or an estate management team. So Kobe sometimes is overkill. But if you've not got a CAFM system and you don't know what data you need or how it inputs, that's when Kobe is very useful, because it's an industry standard, it collates most of the data you need as a maintenance team. That's where you start from. But if you've already got an FM system in place, I would 99% push for structured data, because you get exactly what you need. The teams are far more engaged to delivering it. If anybody has tried to deliver Kobe and work with Kobe, it's fun, especially when you're trying to chase supply chain and manufacturers with the data. It is fun. Yeah, but if you can collate it easier and just say, look, all we need is these 8 bits of data, they're like, oh, we can do that. Instead of, we need this Kobe sheet, you've got to do Kobe, it's got to be part of the model. They're like, yeah, I'm not doing that. And they get worried, and that's not what it's about. They've got the data at the fingertips, so let's just capture it to suit what you need, as an owner-operator, and make it as easy as we can. That's where I'd go with it.
Thank you.
Yeah, one more question.
You mentioned EIR, AIR. That's obviously where you get, it's, I don't know, is that exchange of information requirement? That information is then structured into Kobe and the various things. For the CAFM, which is the computer-aided facilities management, is there a BIM aided FM system that makes it easier to get the data more structured in a format? Because you talked about using the Autodesk cloud, but the BIM FM system will have its own system, its own cloud-based system that obviously needs to interact with the Autodesk system. Yeah. So just trying to understand how that will work, and whether you're suggesting or you're using that.
So there are a couple of sort of recommendations we can make around that and pushing data to a CAFM solution. What you've got to first understand is what data you want in the CAFM solution. But there are a number of CAFM solutions that are able to take data directly from the Autodesk Construction Cloud. So no export, no import. Most CAFM providers now will, if they've got any sense, have a export and import protocol. So they'll say, we can take this data out of Autodesk Construction Cloud and we import it in this fashion. I know that Archibus, QFM, Planon can all bidirectionally integrate with a model. So you can push data from a Revit model through ACC into a CAFM solution and then back again. So there are solutions that are able to do that directly, but a lot of the CAFM providers who can't do that direct integration are creating templates, because why wouldn't you want to take that data from construction phase and put it somewhere? And Kobe, Steve gave a long answer. My view on Kobe is I just say why. If I'm an owner-occupier, why would I want a Kobe drop? Why wouldn't I want data that is just really useful for me? again, get rid of the words, get rid of the Kobe thing, get rid of the BIM thing. I just want data that's really useful to me at the end of the project.
I mean, also as well, the construction cloud isn't just about storing data. We use it during construction to capture data. So if you want the serial number, when it was installed, the warranty date, all that good stuff is captured as you install the asset. You know, and you scan a barcode, you fill all that data in live at the source. That's valuable information rather than just a data sheet that you're going to get with an O&M. It's that data that we need, so we know, again, with this new fire safety bill that's coming, you need to know who's done what, how it was done, when it was done. You need to capture photographs of it, all that good stuff. That's got to be captured and proven as part of another buzzword, a golden thread of data. That's part of the new building safety regs that is coming in. So it's not just about storage of data, it's collating it through design, construction for that end goal of the owner-operator.
Yeah, can we hold any additional questions till the lunch network? I'm happy to pick them up, but we need to jump into our next